Hey, hello everyone, and welcome to yet another Two Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the Two Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And in conversation with me today, I have the very charming Geetha. To give you a brief introduction about Geetha, Geetha Ghaliyavar is a leading sports nutritionist in Bangalore. With over 17 years of experience as a practitioner, speaker, and a columnist, she has a vast experience in the field of dietetics and nutrition. She is a university rank holder and a gold medalist and has a postgraduate diploma with the International Olympic Committee. She is a registered dietitian and a certified diabetic educator. She mentors national, international, and novice athletes by offering holistic sports nutrition coaching. Geetha, thank you so much for joining me in today's Two Talk with Your Dentist conversation, and a warm welcome to you.
Thanks, Rekha. Let's plunge in.
Yes. So I think last time we did have a very brief discussion, of course, about calcium and the bioavailability of calcium, especially in young, in children. So what do you think would be a very good follow-up for a discussion on calcium?
Yes, absolutely. So that was a very interesting conversation we had about calcium, and I think it's so important that calcium are like, they're conjoined twins with vitamin D. So if you do not have vitamin D, calcium is not absorbed. So I
Okay.
think the conversation would not be complete without having talked about vitamin D.
Okay. So how exactly does vitamin D play a role in calcium absorption?
Absolutely. So, calcium metabolism is very complex. So, if you do not have vitamin D, and I'm sure now with COVID, also there's so much vitamin D we are reading about in the newspapers. So, vitamin D is absolutely essential for the calcium to be absorbed from our intestines itself. So, having calcium in your diet is one important aspect, but if you do not have adequate vitamin D, the effort to consume a good amount of calcium in the diet is futile, because if you are not able to have absorption, and if you do not have vitamin D, the serum levels what we would use to analyze. So if you do not have adequate vitamin D itself in your body, which is basically also synthesized in your skin. So many people think that cholesterol itself is, a bad guy, but cholesterol itself is needed for so many important things, like the male sexual hormone is from cholesterol. The food, the fat that we eat itself is digested by bile. That's cholesterol. So similarly, vitamin D itself is synthesized from cholesterol. So cholesterol does have very important functions to play, and the vitamin D is synthesized in your skin, in your liver, and in your kidney. So it's also a very complicated, entire complex function.
Okay, system. Yes. So I think humans are probably capable of synthesizing only vitamin D. I mean, everything else is probably required for us to take it in the form of diet, in form of food. What do you think are the myths that surrounds vitamin D? I think in today's date and time, most of them are aware, that you have to go into the sun to get your vitamin D levels. So what exactly are the myths there?
Have you lost me? Am I
Yeah,
still
you're
there?
audible. You're audible.
Okay, so I was not sure if I lost my connectivity on Bluetooth.
Okay. No, I was,
Yeah.
I was, I was just wondering because vitamin D. Can you hear me?
Yes, yes. Sorry, there was a little bit of hiccup. Tell me.
You can hear me?
Yes, I can on the mobile.
Okay. Okay. I think, like you said, the vitamin D is something that's synthesized in our body. Probably as humans, that is probably one of the very few things we can actually synthesize in our body. So, and considering these times, during the COVID times now, and so much is being told and spoken about vitamin D everywhere, saying that you probably need that, to combat the infection. There must be a lot of myths surrounding it. Like, probably people know that I have to go into the out in the sun to get my vitamin D levels. So, what are the most frequently asked questions? What is it that you encounter frequently on this topic?
Yes. Vitamin D itself is very important for absorption of calcium from the intestine. So now, having said that, it is very important for the skeletal health, that is formation of the bone and teeth. But what about other non-skeletal muscular functions? So vitamin D, now the more research and the more awareness is being brought about with vitamin D being like a skipper. It has very profound influence on the overall health. So it is not just your muscle, your recovery, formation of your bone and teeth because of calcium absorption, but also just in so many ways. We know that in diabetics, even in people who have weight challenges, in obesity, also people who have autoimmune disorders, and for people with even inflammatory conditions, be it arthritis to so many other health consequences. So we know that vitamin D has a very powerful influence even on the way we feel. Sometimes in winters, and we already know seasonal affective disorders like SAP. If you're not able to hear me,
I
I
can
can
hear you. I
you
can
are
hear
able.
you. Yes,
Okay.
yes.
Okay, great. Sorry for this interruption, but yes. So vitamin D has a lot of positive impact on the overall being, and it's not just the bones, but from the brain to even maintaining your weight to maintaining your blood sugars. So vitamin D has a very powerful, play in maintaining one's health.
Health.
So
So,
vitamin D is absolutely needed.
so if we say sunlight is what is required for us to synthesize this vitamin in our body, so what according to you is the best way to get this sunshine?
The most frequent question we are asked is a lot of our clients who assume that they have a cup of tea, and we talked of circadian rhythm. They get early morning sun exposure, so they say no, but I'm in my balcony early in the morning, I'm having my cup of tea or reading a newspaper. But they do not understand that you need UVB rays.
Okay.
And that is available only in the midday sun, and that's between 10 to 1 or maximum 10 to 2. So the UVB rays is available maximum in the midday time.
Okay.
And early morning sun may kind of align those chemicals in the brain and kind of adjust your biological cycles to the day and night rhythm or the cycle. But for the vitamin D synthesis from the cholesterol in your skin, which is the first step, you have to be exposed to UVB rays, and that happens only in the midday between 10 and 1.
Okay, so if that is the time, I think that is the time. Even the probably the heat and the amount of sunshine that we get is also pretty. It's a pretty
Harsh.
tiring. Yeah, it's pretty harsh and tiring also. So how
Absolutely.
long is
So
it
there's another
required?
tip. There's another tip here. So we know that in the warmer the skin gets, the more is the vitamin D synthesis, and that's
Okay,
also the reason probably we also kind of the nature itself has devised it in such a beautiful way that when the sun is very harsh, you automatically have to spend little time in the sun, so you
yes,
don't have to overdo it. So
yes.
based on the timing of the day itself, you like that's another myth. They think that you need to be in the sun for a long time, about half an hour. But that again depends on what's the kind of clothing you're wearing. Ideally you would not want to wear any sunscreen unless and until it's very sensitive part of your face and you do not want to have wrinkles. So but ideally most of your part of the body, maybe your hands, your legs, have to be exposed, and you do not want to wear sunscreen anywhere else. So covering yourself fully and saying I spend a lot of time in the sun. We have kids like golfers, we have cricketers, they are all vitamin D deficient. So vitamin D absolutely, in addition to food and supplements, sun exposure is a must. So you do
Is a
not have to spend long duration unless and until you have very very dark colored skin, because the melanin itself then prevents vitamin D synthesis because it's supposed to protect you from UVB rays. So that
yes.
was the way nature devised in tropical countries, or where we are very close to equator, where the sun is very harsh. You generally tend to have skin which is slightly darker toned. So you then, based on the type of the skin color, the lighter skin people need to expose themselves very little because they have very little melanin. But
Yes.
people like us may need even 10 minutes. If it's midday sun, you don't have to be longer than more than 10 minutes. Or sometimes the best way to know when you have started synthesizing vitamin D is where you have a burning sensation on your skin. You have a kind of twitching feeling, and you already know that you had enough exposure.
Exposure. Okay, okay. So apart from getting that sunshine, say on a daily basis for some 10-15 minutes every day at the most ideal time, would there be a possibility that in our food, in our in any kind of food, some kind of a supplement will be available?
Absolutely. So the first step is the exposure to sun, and second, we always look at food. So unfortunately, we have very few foods that offer vitamin D. So typically, the oily fish, which is wild salmon, that offers the maximum. So a normal person would require anywhere between say 600, 800 international units of vitamin D for a day, and it can go up to 2,000, 4,000 based on which age
Actually,
group are you in. Are you an elderly, are you somebody who has liver disease or kidney disease, is there any challenge with absorption, or are you suffering from any disease which gives you any challenges with absorption, or there's malabsorption. So based on that, you can vary the requirement of the vitamin D requirement for every day. And so wild salmon, gives you the maximum bang for the buck. So it's about almost 1,000 IU, which is about 100 grams. So going by mackerel, which is about 500 or lesser, and the tinier fish, the sardines, they give you about 200 or 250. So the smaller fish can be eaten with the bone, so they're also rich source of vitamin D. So that leaves us with the egg yolk. Egg yolk is extremely very negligible. It's about, I think, 30 odd IU. So it's too little. Unfortunately, among the vegetarians, there's not much opportunity to consume vitamin D. The only available source is mushroom, but unfortunately, what the audience may not know is it has to be sun-grown mushroom. It cannot be these little mushrooms which are kind of grown inside. They have to be exposed to the UVB rays. But there's a catch here again. The vitamin that is available in sun-grown mushroom is D2, which is, you have cholesterol, then it's converted to 7-dehydrocholesterol, and then it converts to D3, which is the most potent way the body uses, cholecalciferol. So the D3 is the most potent way that we can use, and the marine life, that is the fish, offers us D3. Whereas, unfortunately, the sun-grown mushroom offers us D2. So it may not be very effective or efficient in its conversion, but however, sun-grown exposed or, those mushrooms only offer D2.
Okay. So which means to say vegetarians as such don't have much choice. So sunshine probably is there, probably the best way they can get their vitamin D3. But of course, if you are willing to have marine products
So
like fishes, yes, I think that should be good enough. So
one important thing here we would like to say is it's not just also being exposed to the sun. You don't want to wear sunscreen, want some parts of your body, at least 1/3, to be exposed to the sun. But the most important thing is try and find a place which is away from the pollution. Because when you have high amount of air pollution, or as it is when there are clouds, you do not get the rays coming through.
yes.
And now with the gaps in the ozone, that way the UVB rays come through more, which is actually a blessing, unfortunately. Though the pollution kind of has created ozone holes, but the UVB rays reaches more. But however, if there is too much pollution in the environment, in the area where you live, which is unfortunately the biggest problem of urban living, the air pollution itself has a lot of carbon in it. So these carbon particles will kind of deflect or kind of scatter these UVB rays, and due to which, like I said, a lot of people ask us, but I'm not in the age group where I need to have any deficiency, so I don't want to get myself tested. That's another myth, that people think that if you are young or you're a young adult, you don't need to get yourself vitamin D tested. So it's important that I think as routinely once a year, annually, when we do the test, it's good to also cover vitamin D, because most of these packages may not sometimes include vitamin D. It's good to check. Yes, because it's not necessary that you are out in the sun, you are having high level of vitamin D.
Okay. So does it make any sense that if somebody says it's okay, I'm indoors and there is some sunshine that's falling into my through my window or through my balcony doors, it's coming in, and so that amount of exposure is just enough for me, kind of a thing. So they say, okay, I don't want to go for pollution.
Absolutely. We have some very intellectual lot who think that they are sitting in their window, on their windowsill, and they have their vitamin D being formed, unless and until there is a direct exposure of your whole body, to the sun. What I'm trying to convey is that if you have a glass and you assume that the sunlight is still coming, kind of getting through the glass. It's only the light, it is not the UVB rays.
Yes, yes,
So, so you
yes.
do not form vitamin D if you are sitting inside the home and if the sun rays are, kind of passing through the glass.
Through a glass.
Yeah.
Yes,
So it is not helpful. So you
helpful.
need to be exposed
Direct.
directly to the, yes.
Mhm.
So the
Okay,
glass then prevents the vitamin D synthesis. Unless and until
okay.
you are then having an open window or a French window or a balcony where you have the direct sun rays getting onto your skin, that is when the vitamin D synthesis occurs in the skin. Again, if
Skin.
you have other challenges, if your weight is too high, if you're obese, if you're diabetic, you are elderly, and if you have any other health condition, which is like cystic fibrosis or any autoimmune disease, you ought to do your blood test, and then it'll be also ethical for us to then do the supplementation based on, do we need the loading dose, do we need the high dose, do we need a maintenance dose, what is your age group, are you a young child who needs a lower dose of maintenance every day, a daily dose, or do you need, slightly higher based on the blood test? That's when we take a call.
Okay, okay. So I think again, this is again a huge topic, and there's so much more that we can actually discuss and talk about. And like how you said, one is linked to another. So our diet has to be a wholesome, well balanced diet where everything comes in the right proportion every day, so that every part of the functioning of every body part, or every like what we say, the reactions that happens in each component
True.
is well balanced, and it's done properly. So like you
Absolutely.
said,
So
like you
also as a closure statement, vitamin D has a very immense role to play in immunity, and that is why I think with COVID there's so much, predominance of vitamin D. The talk that has been going on, but vitamin D does not prevent you from the virus. So to
yes,
clarify,
exactly.
it may only reduce the, the symptoms or the severity of your body's reaction, because vitamin D has a very high, role to play in the body's immunity and the coping abilities.
Yes, yes. I think during these times, I think that's what becomes important. Of course, talking about the relevance of vitamin D required for calcium and strong bone formation in current
True.
times, immunity in general is
So a lot
something
of
that.
people also, Rekha, take vitamin, they think vitamin D is cod liver oil. So they take,
Ah,
consume
plenty
a lot of cod liver oil and, chronically, like consume cod liver oil for a long
over a period
duration.
of time. Hmm.
Yes, but what happens is cod liver oil is basically also very high in vitamin A. And these vitamins are fat soluble vitamins, so these get stored in the liver, they do not get washed out like, your water soluble vitamins, which are your water B vitamins, also vitamin C. So they do not realize that when you keep unnecessarily, like, I had this one
Loading.
client who inadvertently just kept taking vitamin D in the wrong dosage, but then they don't realize that it's a fat soluble vitamin, it gets stored in the liver, it can be toxic, and
Yes.
these vitamin interaction, so very high amount of vitamin A can kind of, bring down your vitamin D. So people take a lot of cod liver oil without realizing that it's not just vitamin D, though cod liver oil has vitamin D
Vitamin D.
also extremely high in vitamin A.
Okay. Yes, yes. So I think what is really important is that you keep talking to your dietitian, on, of course, as doctors, we prescribe and say, okay, this is required for you, this is required. But I think to get an exact idea of, the quantity that's required, when to start, when to stop, how much to take, I think only a dietitian, and people like you can guide patients on that.
Yes, and doctors too.
No, that's exactly what I said. I mean, we tell them, okay, this is required and this is what needs to be done. But I think as a follow up, like you said, probably the doctor said, okay, take cod liver oil, and then they just took it like, without stopping.
Absolutely. They think, too much of a good thing. They think it's good for you and overdo it, but do not realize that they are toxic in larger doses.
Yes, yes, yes. So I think we just spoke about vitamin D, and I think it's again such a huge topic. And I'm so glad you managed to put the entire topic into such a short time, and try to tell our patients the importance of vitamin D and how that is required for calcium absorption in the body.
Lovely. I'm glad that it will help the larger audience and they will be able to take the, right actions, and also, you know, uh, be mindful of these things.
Yes, yes, yes. That was indeed very interesting, Geeta. Thank you so much for joining me in today's talk. And I really hope I'll be able to get you back to do another talk on any other topic, where probably some myths that patients have, and some understanding and information that they need to understand about their own body, they'll manage to take away.
Anytime.
Thank you so much. Viewers, that was our dietitian, Geetha Ghaliyavar, who did talk to us about the importance of vitamin D and its role in calcium absorption. I hope that talk was helpful. If you have any doubts or queries, please don't hesitate to write to us and we will get back to you on that. And for more information about your oral and dental health, visit our website, www.thedentaire.com. Subscribe to our YouTube channel, and you can follow us on other social media platforms. So until next time that I come back with another topic on your oral and dental health, keep smiling, stay safe, and be happy. Thank you.